Good morning. I am Nicolas Girard, a thoracic oncologist working at Institut Curie in Paris, and I am the current president of the ITMIG, the International Thymic Malignancy Interest Group. This is the 11 years of ITMIG, and I will describe some of the key achievements of the society over the years. Here are my disclosures. The ITMIG history actually starts in 2003 when patients and family members created the Foundation for Thymic Cancer Research, the FTCR. The FTCR organized several conferences with key experts in the field who had published about thymic malignancies over the past years. This meeting became international in 2009 with the first international conference on thymic malignancies in Bethesda. It appeared that there was a need for an international multidisciplinary society dedicated to thymic malignancies, and in 2010, the first ITMIG conference was held in New York. Over the years, annual meetings were organized all over the world, gathering the expertise from multiple people, including physicians, pathologists, and biologists, immunologists, and obviously with the participation of patients. We have to acknowledge the leadership and the huge work of our past president of ITMIG, Frank Detterbeck, Bob Korst, and Edith Marone. The ITMIG is organized through several committees: education, communication, finance, membership, nominating, program committee, webinar committee, but the key scientific achievements of the ITMIG are part of the research and infrastructure committee, including the database, the thymic carcinoma working groups, and I will describe some of our achievements over the years. ITMIG is before all a community of experts and patients. At annual meetings, one of the major setting is the discussion among experts, but also with patients. And this is something that obviously we need to continue through this webinar, through the discussion that we can have virtually given the COVID-19 pandemic. The first achievement of ITMIG is actually the definition of common terms and criteria, common definitions. In 2010, during the first international conference on thymic malignancies, it appeared that we were not exactly speaking the same language. Obviously, between specialties, between surgeons and medical oncologists or radiation oncologists, but also between people from different geographic areas. So it was very important to better define staging classification, how to report radiological findings, how to measure the outcome of patients, how to define the different treatment settings for radiation oncology, systemic therapy, how to communicate between surgeons and pathologists. Those key consensus definitions were published in 2011 in the Journal of Thoracic Oncology and represent the most cited papers in the field. These definitions are currently updated, and you can find those updates on the ITMIG website. The ITMIG expertise has been recognized through its participation to the WHO histopathological classification of thymic tumors. This is the very last edition of this classification, which was published several weeks ago, and this volume was actually produced in collaboration with multiple societies, including ITMIG for thymic malignancies. ITMIG was also key in the Cancer Genome Atlas project on thymic epithelial tumors, which was published in Cancer Cell in 2016, a very unique study of the molecular immunological features of those tumors. This landmark paper is, again, one of the most cited papers in the field. Our key project at ITMIG is the database, because it's given the rarity of the disease, it is very important from a single center to study a sufficient number of cases to have a global view of the management of the disease, of the outcome of patients, and the best choices regarding the treatment strategies. So it is very important to work together to collect as many cases as possible to better understand what is the best management for each situation from the patients. The retrospective database was our first project, collecting patients from diagnosed between 2000 and 2010. This is a very unique collection of more than 10,000 cases from 88 hospitals. This retrospective database is currently being updated for the outcomes of patients, and we were able to make major scientific advances based on those patients. With a better understanding of postoperative radiation therapy, paraneoplastic syndromes, thymic carcinoma, histopathological classification, this retrospective database is a very unique tool to understand what are the best options for our patients, what are the key characteristics of the tumor from one region to another, and what are the key outcomes for our patients. We have also used this retrospective database to update the staging system of thymic tumors with landmark papers published again in the JTO in September 2014. The current TNM system that we are using every day to treat our patients was based on the ITMIG retrospective database. We are now moving to the prospective database with nearly 2,000 patients from 80 hospitals. This prospective database offers the opportunity for a better quality of data, a better follow-up of the patients. The prospective database, as you may know, has been closed over the past 2 years given the technical difficulties that we had with CCHub, which was hosting the ITMIG prospective database, but it's now reopened at itmig.curie.fr, and all the cases that had been enrolled in the system are there and will be updated. Additional patients will be recorded in this prospective database. This database will be used for further projects, including the staging system updating, including the analysis of all the aspects of the disease, because this prospective database is very unique, as this is a multidisciplinary database collecting not only surgical outcomes but also medical oncology, radiation oncology treatments, collecting radiological features, pathological features. So we have a global view of the disease and the management of the patients. ITMIG is also organizing a virtual tumor board to discuss complex cases and complex clinical situations every month, again, in a multidisciplinary international setting. Please visit www.itmig.org. This is our website. You will find all those information, and please contact us if you have any question. ITMIG is a very open group of people. Everyone can contribute to our projects. Everyone can participate and provide some insights. So I would like to thank you for your kind attention, and I hope that you will enjoy this webinar.
Good morning, good afternoon, or good evening, depending on where you are. I'd like to thank you for joining this ITMIG webinar, and I'd like to thank Margarita for organizing these webinars. I come to you as the treasurer of ITMIG to let you know how near and dear this is to my heart and how much we need your support and appreciate your support for the development and continued growth of the International Thymic Malignancy Interest Group. Now, as you just heard from Nicolas, our new president, who is poised with his skills and knowledge and care of thymic patients to bring this institution and group to yet another level, as all the past presidents have. So thank you, Nicolas, and thank you for your summary of where ITMIG is right now. Now, I've been fortunate to be part of ITMIG since the very beginning of ITMIG, with being part of the collaboration of patients and researchers and physicians who were around at the early formation of ITMIG. Now, ITMIG was founded by patients, patients' families, and physicians. It was really a heartfelt effort, a need that both the physicians felt with a dearth of common knowledge and expertise and studies in the thymus, coming together with patients and families who saw that many physicians around the world did not have a clear understanding of the disease, did not have a clear understanding of how to treat the disease, and did not even know who to reach out. So this genesis of patients, families, and physicians came together in a very small group and was funded mostly or almost completely really by patients and the generosity of doctors getting together on their own time to help form International Thymic Malignancy Interest Group. And it has grown tremendously to an international collaboration that is now continuing and poised to help patients worldwide. We've seen unprecedented 10 years of growth and development of ITMIG from a group of physicians and patients in a small room for several years. We've grown to an unprecedented international group of interdisciplinary collaboration. Over 10 years of patient support and advocacy, and over 10 years of real progress in the treatment of thymic diseases. Multiple papers, hundreds of papers have been published about the care of patients with thymic malignancies or thymomas or myasthenia gravis or anything related to the mediastinum and thymus that may be related to our research and interest. This collaboration is touching patients and physicians all over the world and has set up an infrastructure that is key to the continued study and, dare I say, cure of many of these diseases. Now, the research, education, and patient advocacy, physician ITMIG work and time is 100% volunteer. The infrastructure support is 100% philanthropy, including physician philanthropy, along with membership fees. We basically pay for our shoestring budget. Every single penny that we receive, every gift that we receive from generous support from patients and from physicians goes to help generate our research platforms, our international collaboration, and our goal to help patients and really understand and treat this disease in a uniform way so that every doctor, wherever they may live, can treat a patient with a thymic malignancy or a thymic-related disease such as myasthenia gravis together and with excellent research guidelines and understand how to treat that patient both compassionately and scientifically toward a cure. So we need your generous support, and we greatly appreciate your generous support. And remember, this organization, it's extremely unique. Most organizations are based around a medical specialty, surgeons, oncologists. This organization is built around patients with thymic malignancies so that physicians of all shapes and sizes and different backgrounds, surgery, radiation oncology, oncology, radiology, psychiatry, neurology are coming together for the explicit interest of improving this disease and improving the lives of patients with this disease. So please, great gratitude for any support you can give us. It's a time of need for many, and we understand that. But I can tell you that every penny is going to be used to the best of our ability to help further this field and help patients. Thank you. So go to itmig.org, and on there you can donate. This website is new, made to be patient friendly, and can help. You can navigate all sorts of news and education, as well as help donate on a regular basis, hopefully. Again, appreciate your time and look forward to seeing you or talking to you at the end of the webinar. Take care.